While the second nurse to contract Ebola in the United States has been declared free of the virus yesterday, the situation in West Africa where the Ebola outbreak is killing thousands of people is yet to be contained. According to the UN authorities, they are having trouble figuring out how many more people are getting the virus in Liberia and Sierra Leone and where the hotspots are in those countries, which is harming also the efforts to get control of the raging deadly outbreak. Let's take a look at the following report and take it from there.
Quarantine is a subject of criticism in the United States. The American nurse returned from Sierra Leone, where she provided treatment to sick Ebola patients, has finally been authorized to go home. In spite of an absence of symptoms, she was quarantined in a tent adjacent to a hospital as a preventive measure. This made her very angry. The scandal reached the White House, which urged the New Jersey governor to lift the quarantine.
Because of her hard work, we are going to stop this disease in its tracks in West Africa, and that is the only way that we can eliminate the risk that this disease poses to the American people. So her service and commitment to this cause is something that should be honored and respected, and I don't think we do that by making her live in a tent for 2 or 3 days.
The decision was taken on Friday by 3 states, including New Jersey and Illinois. As Ebola continues to spread in West African nations, many experts see these preventive measures as discouraging potential volunteers.
It's very important that healthcare workers who come leave their families, leave their relatively comfortable lives, and visit here and are willing to put themselves in the vicinity of Ebola.
These are fears that are sowing discord in a crisis situation. The New York mayor has strongly criticized the decision of the New Jersey governor, saying that the nurse in question does not present a risk, but rather is a humiliated heroine.
And we are joined now from Liberia by Peg Ross, Vice President of Global Human Resources, PCI. Peg, good morning to you.
Good morning.
Well, first of all, thank you so much for joining us. I think that over the course of the last several weeks, many people in the Western world were speaking about Ebola only in context of New York, Europe, because, you know, very few cases have reached, sadly so, the Western world. But there are things that we cannot let go of, and that's what's going on in Liberia, and you are there. What are the main problems right now with containing this horrible outbreak where it's really killing thousands of people?
Well, I think one of the main issues is we just need more treatment facilities, and the U.S. government and other agencies are working really hard to build more Ebola treatment units and bring them online. The Liberian Ministry of Health and Social Welfare is doing really an amazing job with providing healthcare workers and trying to contain the outbreak. But we have I don't know, 600 beds coming online in the next month, and we probably need 2,000. And we're not alone. I think Guinea and Sierra Leone are in similar circumstances.
No, and so they said this morning, the UN said that the problem in Liberia, Sierra Leone, exactly as you mentioned, is the fact that, you know, more resources are needed, but also that they're having a very hard time, and I'm wondering if that's happening in Liberia, to contain the outbreak. And what is being done on the ground to try and, you know, and help the people and help contain the outbreak of Ebola in Liberia, for example?
Well, I would have to say I think Liberia is doing an amazing job. I've been here for almost a week now, and everyone is taking it very seriously. Wherever you go, whether it's to the office, to the grocery store, to a restaurant, there are chlorine and water stations to wash your hands outside. You get your temperature checked before you're allowed in. At the office, we are checked in the morning and the evening when we leave. We have to log our temperatures, and also I'm keeping track of where I go, who I see. But I think where this crisis is going to be contained is really at the community level, with messaging around Ebola prevention, how households can protect themselves, what to do if people have symptoms, where to take them. And I think that's really where the outbreak will stop. That's what's really needed. And I think the problem is that if someone has Ebola-like symptoms, it's very difficult, number one, to get them to a location, to a clinic that can assess whether it's Ebola or another disease that's very, very prevalent here, such as malaria. And sometimes people just, there's no space, and so people aren't being seen and not being treated.
Yeah. Peg, first of all, thank you so much for joining us. Amazing and blessed work that you're doing out there. Thank you for being with us this morning. And as we mentioned, indeed, it is Liberia, it is West Africa, where the problem is the most serious or it needs to be contained. Thank you. Now.